Good afternoon. Good afternoon. I am State Senator Vernon Sykes, the moderator for this discussion today. Today, we will explore the incident, impact, and strategy to address child hunger and food insecurities. I represent the Senate District, the 28th Senate District in the greater Akron area in Summit County. I currently serve on several committees that have impact on child welfare in Ohio, including the Primary and Secondary Education Committee and the Ohio Commission on Fatherhood. I'm the ranking member of the Senate Finance Committee and a member of the Controlling Board. I have also spent more than 30 years advocating for children's rights. I successfully fought to expand access to early childhood education, to make higher education more affordable, and sponsored child abuse legislation. The unfortunate reality is that 1 in 4 children in Ohio experience food insecurity. The United States Department of Agriculture defines food insecurity as a lack of consistent access to enough food for an active, healthy life. Food insecurity is a major public health issue that impacts families in every corner of the state, especially in African-American households that are twice as likely to be food insecure than white non-Hispanic households. Families experiencing food insecurity must make tough decisions, especially as they battle with higher cost of living, inflation, low income and wages, and other societal stressors. Public officials have the opportunity and the responsibility to adopt programs and budgets that provide efficient and effective strategies to reduce child hunger and food insecurities. According to the United States Department of Agriculture, food insecurities for households with children declined in 2021 to the lowest rate in 2 decades. That was because of the expansion of government assistance and federal pandemic waivers. I fought to extend the deadline for federal pandemic waivers that have now expired. These include the child tax credit, increased benefits for SNAP, and the expansion of school nutrition services. In fact, Ohio school districts, even without additional assistance, have been and remain at the forefront of addressing the burden of food insecurities for students and families. Nearly 1 million students in Ohio rely on school meals provided through the National School Lunch Program. For some, school lunch may be the only meal a student has in a day. In Summit County, 15% of students live in poverty, 52% are economically disadvantaged, and 28% receive SNAP. Access to school meals have proven successful in reducing hunger, improving health, and academic success, as well as providing families economic relief. Research shows that school meals improve school attendance, academic achievement, standardized test scores, and overall cognitive function. Consumption of school meals increase food security, reduce obesity rates, and improve physical and mental health outcomes. We must and can end child hunger to fully recover from the pandemic and to ensure that our children are healthy and have the best chance for success. Today's program is a call to action for Ohio leaders to implement policies that address food insecurity and support efforts to reduce child hunger. We have a distinguished panel today to help us explore these items, this topic a little bit more detail. And we're going to start with Alexis Bylander. She's the Senior Child Nutrition Policy Analyst for the Food Research and Action Center. Ms. Bylander?
Great, thank you so much. I am really honored to be with you today to talk about food insecurity and the federal nutrition programs. And like the senator said, my name is Alexis, and I work at the Food Research and Action Center. I thought a good place to start today would be to give you a little bit of background about what we do. The Food Research and Action Center, commonly referred to as FRAC, is the leading national nonprofit organization working to eradicate poverty-related hunger and undernutrition in the United States. We advocate for federal, state, and local public policies that protect and strengthen the federal nutrition programs. We provide coordination, training, technical assistance, and support on hunger-related issues. And we support free, healthy school meals for all legislation across the country. I am joined today by my colleague, Crystal Fitzsimons. She is the Director of School and Out-of-School Time Programs at FRAC and has spent over 20 years studying and advocating for the federal nutrition programs, and she will be available to help answer questions during the Q&A. So let's jump right in and look at food insecurity rates in the US and in Ohio specifically. The senator already provided some definitions, but just to echo his remarks, when we talk about food security, we're talking about households that have access at all times to enough food for an active, healthy life for all household members. In contrast, when we talk about food insecurity, we're talking about households that at times during the year were uncertain of having enough or unable to acquire enough food to meet the needs of all their members because they had insufficient money or resources for food. Data from the US Department of Agriculture tells us that in 2021, 13.5 million US households, which is about 13%, were food insecure at some time during the year. Food insecurity was higher for households with children, and rural households and Black, Latinx, and Native American households experienced disproportionately high rates of food insecurity. Next. This map here from USDA shows rates of food insecurity across the country. Ohio is in orange, which notes that the food insecurity rates for your state are around the average, the US average. Your neighbor, Pennsylvania, has food insecurity rate slightly below the US average, and nearby states of West Virginia and Kentucky have a food insecurity rate that are higher than the national average. Next. These data points are from our partners at Feeding America, and their data shows that Ohio has about a 14% food insecurity rate, which means that 1.6 million people in the state are food insecure. The map on the left shows food insecurity rates by county. The counties in the light green have food insecurity rates from 0 to 10%, and the 10.8%, and the slightly darker green are food insecurity rates of 10.9% to 21.7%. Next slide. Also from Feeding America, I think is this helpful chart that estimates program eligibility among people experiencing food insecurity in Ohio. So 37% of them are above the threshold, the threshold of 185% of poverty. So they don't qualify for reduced price meals. The next category, 12% of the people that are experiencing food insecurity are between 130 and 185% of poverty. So they can receive, their children can receive reduced price meals at school. And then the 50% in the bottom row here are eligible for free meals at school. And when we talk about different levels of the federal poverty line, it can get abstract. So I've included 2 reference points here for context. Households that are eligible for free school meals at 130% of the federal poverty line. That means that, for example, a family of 4 would be living on an income of $36,075 or less. And households that are eligible for reduced price meals at 185% of the federal poverty level, that would be a family of 4 with an annual income of between $36,076 up to $51,338. And I think we all know that with the rising cost of food and other variables, these are relatively low incomes for a family of 4. FRAC also hears frequently that families that receive reduced price meals struggle to pay the co-pays for those meals. And it's also important to remember that being just even a few dollars over the threshold of $51,338 for a family of 4 means that those families don't have access to reduced priced meals. Next. So there have been several federal anti-hunger initiatives during the pandemic in recognition of the high unemployment and high food insecurity rates that were happening. And here are just a couple of examples. First, schools were allowed to serve free meals to all students. That started in the spring of 2020 and then went through the 2021-2022 school year. Additionally, waivers from USDA were given to support access to school meals and support program operations for schools and community sites. A couple of examples of the waivers were that parents were able to pick up meals from the school without having the kids present, and parents were able to pick up multiple meals at a time. And then the final example is the Pandemic Electronic Benefits Transfer, or PEBT program. PEBT provides nutrition resources to families who had lost access to free or reduced priced school meals or childcare meals due to closures. Families were able to receive money on a new or existing EBT card and then use them at the grocery store to help fill the meal gaps. Next. So let's take a look at the impact of hunger on health and learning. I'm sure it's no surprise to you here that hunger has a negative impact on a children's health and their ability to thrive in school. Children and adolescents experiencing hunger have lower math scores and poorer grades and are more likely to be hyperactive, absent, and tardy. Teens experiencing hunger are more likely to have been suspended, and children with hunger are more likely to have repeated a grade, receive special education services, or receive mental health counseling than children who are from low-income households that do not experience hunger. Next. While there is a variety of research that talks about the negative impact of hunger on learning, there's also a wealth of research that shows the positive benefit that school meals, particularly breakfast, have on learning for children. School breakfast has been linked with fewer visits to the school nurse and positive impacts on mental health, including reductions in behavior problems, anxiety, and depression. Students who participate in school breakfast programs have improved attendance, behavior, academic performance, and academic achievement, as well as decreased tardiness. And at community eligibility provision schools, where all students have access to free meals, multiple out-of-school suspension rates decreased. Next slide. So let's take a closer look at the federal child nutrition program, specifically school breakfast and school lunch. Millions of children from low-income households benefit from federally funded breakfast and lunches provided through the school breakfast program and the National School Lunch Program. School meals support academic achievement, they reduce food insecurity, and they improve health, making them as critical for students' academic success as textbooks. Next. According to FRAC's annual report, 14 million children received breakfast and 19.8 million children received lunch on an average day during the previous school year. And it's important to remember that during the 2020 to 2021 and the 2021 to 2022 school years, schools had the ability to offer free meals to all students. Next. So Crystal and I looked at participation rates in those programs in Ohio. And on an average day for the last school year, around 450,000 students participated in school breakfast, and a little over 725,000 students participated in school lunch. Then we looked at participation data before the pandemic and found that 1 in 4 children that were eligible for free or reduced price meals did not participate in school lunch, and 1 in 2 children did not participate in school breakfast. And so the main takeaway in looking at all of these numbers is that when all students had access to free meals at school, more students participated than they did pre-pandemic. Next. So this is a topic I'm really excited to talk about, which is the idea of free, healthy school meals for all. Next. And this is the vision that all students have access to a free breakfast and lunch, regardless of their household income. Next. And the pandemic really increased interest in this policy and in this vision because COVID-19 almost immediately highlighted the critical role that school meals play for children. And free school meals for all students during the pandemic effectively served as a trial run for what this policy would look like. There are many benefits to providing free meals to all students. It ensures that all of them are hunger-free and ready to learn. It reduces any stigma that may exist in participating in the meal program. It ends unpaid school meal debt, which is a significant problem across the country for students, families, and school staff. And it eases the administrative burdens of operating the meal programs for schools. School Nutrition Association survey found that school meal program directors across the country found that serving free meals for all during the pandemic increased access, improved equity, and fueled a large decrease in unpaid meal debt. And there has been a steady stream of supportive earned media over the last couple of years for this concept. These are just a couple of headlines that I pulled, but could have included many more. And here's a map that shows the momentum building across the country. So the states in blue, California and Maine, have passed permanent free healthy school meals for all policies. The states in red, Nevada, Vermont, and Massachusetts have passed policies to provide free school meals for all students during this current school year. And the states with green circles around them show where there are active campaigns for this type of policy. Next. And then I just wanted to close by talking about a variety of state efforts we've seen to address childhood hunger. Of course, the free school meals for all legislation, which I just talked about. Additionally, you probably saw that Pennsylvania is offering free breakfast to all students during this current school year. Some states have chosen to eliminate the copay for reduced priced meals, so those students have access to the meals for free. And some states have passed legislation to ban lunch shaming practices, which has been a real problem across the country. Next. So if I could share just some summary points I hope that you'll take away from my presentation is that there are approximately 1.6 million people in Ohio living with food insecurity. Hunger harms health and learning for children and teens. The school nutrition programs provide healthy meals, particularly to students from food insecure households. And momentum is really building across the country to provide free, healthy school meals to all students as a permanent part of the school day. Thank you so much for the invitation to be with you today.
Thank you, Alexis. I certainly appreciate that. And we look forward to you answering some questions as we move to the next phase. But right now we have Andrea Hilton. She is the Director of Nutrition Services for the Wellington Exempted School Village. Thank you for joining us. We look forward to your presentation.
Thank you. I am so thrilled to be here. As he said, my name is Andrea. I am a registered dietitian and the Director of Nutrition Services for Wellington Exempted Village School District. All right, so a little bit about the school and the community. We are a relatively small rural school district located in Lorain County. Our enrollment is a little over 1,000 students. We have a Head Start program here, and then it goes through the 12th grade. Currently, for this year, as of today, when applications were processed, are students considered economically disadvantaged, so those who do qualify for free or reduced price meals, it's about 38.5%, with close to 30% being free and reduced about 8.58%. This is slightly higher than what we've seen in the past. In other years, we were closer to about 30%. So far, there have been some parental concerns about those income cutoff levels, and I actually thought that figure that Alexis showed about those people who do not receive the benefits was actually very helpful. I've had some calls from families who are upset because they missed the cutoff maybe by a couple $100s, and they've expressed to me that it's upsetting that the applications only include gross income and do not include a lot of those other factors that go into providing food steadily for children every single day. So here are some pictures actually from our district, from the elementary school, from the high school and middle school, some of the students that we serve, the meals that we serve. I think it's important sometimes to take a step back and realize that the decisions that we're making have an impact on real people. And what better way to show that than showing some of these students' smiling faces. So as a registered dietitian, I've had the opportunity to work with a large array of age groups. And my passion and where I truly believe that we can make the most impact is with children. Dietary patterns in childhood are strongly associated with patterns later in life. And I actually saw these statistics play out in my own professional life working in long-term care and acute care hospitals, generally speaking, the adults whom I counseled who refused to entertain the idea of changing some of their dietary patterns to promote their health, who often refused to eat things like fruits or vegetables and were greatly suffering, shared stories from their childhood and shared that this is the way that they've always eaten. And it's actually those types of stories that caused me to do a little bit of a career shift and come into school nutrition, because the focus should be on prevention so that we can make the largest impact here. Children are said to consume at least half of their caloric intake during the school day, which means that this is the perfect opportunity for us to promote lifelong healthy habits and to give exposure to fresh fruits and vegetables. You can see Madeline in the top right-hand corner there, proudly showing all of the fruits and vegetables that she has taken. And she encouraged a lot of her kindergarten classmates to try zucchini for the first time in their lives. So it seems like it's little things, but it's really creating an impact that is with these children for their lives. Next. All right, so here's what we're experiencing so far in the school district with the expiration of the universal free meal waivers. So we're still battling with increased costs of goods, as most people are right now. The figure here is from a GFS report about wholesale costs. It's the blue line there. Those wholesale costs are higher than cost of food in the grocery store, cost of food away from home, about 13.4%. It's down slightly from where we were last spring. We were closer to about 14.8, but the fact of the matter is it still is more expensive than what we're used to, and we're not really sure what to expect moving forward and what those costs will look like. Another thing is that, unfortunately, a lot of the items that are a little bit more expensive are the fresh fruits and vegetables, especially local. So we have decided to really put an emphasis on those items this year and try to offset the costs associated with that with some of the pandemic funds that we were given last year to purchase those fresh fruits and vegetables, and so that we can really give those to students. Another thing is that we are seeing a lot more students pack lunches this year because we have transitioned to paid meals, which we were anticipating, but I've been walking around just trying to see what students are bringing. Very few fresh fruits and vegetables in contrast to what is available for them every day in the school district. Lots of Go-Gurts, Lunchables, things like that, which can be acceptable in moderation, but there's just a vast difference between what we're offering and what students can bring from home sometimes. There's also students without food. So we see a lot more lunch boxes. There are some students that definitely still purchase meals, and we do have a large amount that qualify for free and reduced price lunches, but some of those students are without meals. And we try to do a great job about outreach and making sure that we are talking to those students that we see individually. We don't have a charge limit anymore at our school, but sometimes parents will actually put a charge limit. So I've talked to some parents already just to kind of let them know that their child isn't eating, because we want to make sure that we're doing our due diligence too. Sometimes parents will say, okay, they can charge, or we'll send in some money, but some will say, no, they ate a large breakfast, they ate at home. If it's something concerning, we'll send it on to an administrator so that they can address it and make sure that that family is okay if they need to do a wellness check. But that's something that we're combating too. The little ones will sometimes complain of hunger. And so it takes us a lot longer to provide help now than it did when meals were free universally. There's some confusion about the change from universal free meals to paid meals. So we've done a lot of outreach calls with parents, just making sure that they understand if they do qualify. We've talked to high schoolers who actually didn't realize that they did qualify for free and reduced price lunches, just to make sure that anyone who can get those benefits are getting them. So here's what we saw when we did have universal free meals. And I think that Alexa's takeaway about when students had access to meals, more students participated than when they did not. And that is absolutely what we saw. So I just have statistics for lunches, but we did have an increase in breakfasts too. But in school year 2018-2019, we served about 18,308 lunches. In school year 2021-2022, we served 21,930 lunches. So that means we fed students 3,622 more times. So think back to those faces that you saw in the earlier slides. We're feeding students more when we have universal free meals. We also definitely saw a reduced stigma with free and reduced priced qualifications, especially at the high school level. We saw students come through the line who we have never seen before, but they weren't new students. They were taking advantage of these meals and really getting the nutritional quality that comes along with it. It also decreased the amount of students that were going to fast food restaurants or even bringing fast food in the morning. We know that there are some strict federal regulations and state regulations about what we're allowed to serve in the school district. So amounts of saturated fat, sodium, calories in general, making sure we have a variety of fresh fruits and vegetables. I feel very proud about the food that we're serving here. And I know that it can help the students and set them up for success in the future. So as a dietitian and as a nutrition provider in a school district, I absolutely support free meals so that students have the tools that they need to learn and to give them the opportunity to focus on school and to focus on childhood rather than hunger or their school meal debt. And thank you for having me.
Great, thank you. Thank you very much. We're moving now to Catherine Ungar. She's a lawyer and a senior policy associate for the Children's Defense Fund here in Ohio.
Thank you so much. Thank you for having me. It's a tough act to follow, Alexis and Andrea. So just thank you both for being here and thanks for having me as well.
We
Next
saved
slide.
the best for last.
No. Next slide, Allison. So it is my honor to sort of be representing the Hunger Free Schools Ohio campaign and coalition. And we work very collaboratively with FRAC and are appreciative for all of the technical assistance and expertise that they provide. So just really great to be presenting alongside them today. And then I did just want to really quickly call out, Andrea, those pictures of the school lunches. I think those really speak to the importance of school nutrition providers and why we have them. And I remember having a conversation with you around how that's sort of where your passion lies around making the meals, not collecting the school debt, but making sure that those school meals are healthy and prepare kids to have the energy to learn. So I just wanted to say thanks for showing those pictures today. But going back to the Hunger Free Schools Ohio campaign and who we are. So we are a passionate collective working to take hunger off the table and committed to ensuring that every student in Ohio has access to healthy school meals. Next slide. So here is just a little snippet of some of the logos. This group is 40 plus organizations and growing. We're comprised of the Ohio chapter of American Academy of Pediatrics, the Children's Hospitals Association, the Ohio Federation of Teachers, Ohio Education Association, School Nutrition Association of Ohio, and the list continues, advocacy organizations, anti-hunger. This is sort of a broad-based coalition and has gained huge support and momentum from understanding that kids were getting free school meals last school year, and then that those suddenly were taken away and are no longer is no longer the case for this school year. So I'm appreciative to this collective, and I think the number of organizations that are dedicated to this issue just propels this forward. So thank you to this group. Next slide, please. So if you'll visit our website, you'll see some of these images, and I know that they've already been discussed, but I just wanted to reiterate that 1 in 5 or even 1 in 4 children are food insecure, which is an unacceptably high rate of hunger. And then one thing I really want to emphasize is that in every corner of our state, whether it's urban, suburban, rural, that food insecure children live in every corner of our state. And many parents, I think, oh, this doesn't happen in my school. And they'd be surprised to learn that it happens much more than they would think. And that sometimes that school meal is really the only meal that a student is getting that day. And then this has already been emphasized many times, but hungry students can't learn. And so investing in school meals for all children is really an investment in Ohio's kids, is really an investment in Ohio's future. Next slide, please. So from an asset-based mindset, I think we'll see better educational outcomes, and then we'll see less food stigma. So right now it's reverted back to sort of the pre-pandemic times where we categorize children as a free or reduced or a paid student. And you can imagine that creates a lot of stigma in the lunchroom. And oftentimes those students who might benefit the most from accessing that school meal because of embarrassment, because of that stigma, are dissuaded from doing so. So again, just to reiterate, we've talked to numerous school nutrition providers in our state, and almost every single one of them has seen an uptake in school meals accessed as of last school year when we had school meals for all. It will be interesting to see as we can collect that data sort of from September to see if those numbers have decreased as we reverted back to that paid meal way. And then really, when we think about equity, it really levels the playing field. When food access varies across families, students don't start from the same line, and free school meals give students that nourishment they need to give school their best shot. And we're talking as early as pre-K and kindergartners. It really makes a difference. Next slide, please. So I know that Alexis provided some of the national survey data from national school meal providers, but I sort of wanted to take to introduce you to some of the data that we found in a survey that Children's Defense Fund Ohio did in collaboration with Baldwin Wallace University around what parents really want out of their schools and looking at whole child well-being, in which we did ask some questions around child nutrition. And I think that the results were staggering in that super majority, so 82% of Ohio parents, and this is across demographics, across socioeconomic status, across political party, but 82% of Ohio parents agreed that school meals are helpful for their families. And we wanted to look even more detailed, sort of how much are parents utilizing or caregivers utilizing those school meals. And 64% of Ohio parents said that their child had eaten a school provided lunch at no cost at least once in that prior week. And then 46% said that their child had accessed 5 days a week a school meal at no cost those prior days. So you can see a lot of families really rely and depend upon these school meals to feed their children. Next slide, please. And then I think the big kicker here is, what do Ohio parents want? And they want hunger-free schools for all. And so when we asked them, 87% of Ohio parents with school-age children K through 12 agreed that school meals should be provided at no cost to all students, regardless of that student's ability to pay. Again, that was across demographics. Next slide. So some of the recommendations, and we did send a letter to the governor and the administration in July. We would like to see state funding, American Rescue Plan Act funding, of which we have a lot of, or general revenue funding, to supplement federal meal reimbursement to ensure that all students in Ohio have access to school meals. I know you heard about it, but 5 states have done so. And then Pennsylvania just passed legislation to provide free school breakfast to all children. Next slide, please. So we were really thrilled to learn that last week, the State Board of Education passed a resolution recommending that the General Assembly use American Rescue Plan Act funds to provide 100% free meals to Ohio students, and that includes both breakfast and lunch. I did want to just put, so there is a ARPA tracker that Ohio Poverty Law Center and Advocates for Ohio's Future put together that looks at the different federal funds that flowed through Ohio through that ARPA. And while we received around $5 billion in the state of Ohio, looking at that state fiscal recovery fund, and we have allocated around 65% of it, there's still around $2 billion that remain to be allocated. And so this would just be a small portion of that, but a huge impact and a huge investment in children in Ohio schools if we could provide school meals for all for this school year. Next slide, please. The other recommendation I want to mention is around anti-lunch shaming. Ohio is not one of the states, although there are many, that has passed anti-lunch shaming legislation. And so I know it's been talked about, but there might be a little bit of confusion as to what lunch shaming means in the context of school meals. So I just want to let a lot of people know that, students as young as kindergarten might go up to the school meal lunch line, think that they're accessing that hot meal for the day. And then it turns out that they have accrued a certain amount of debt, sometimes as low as like $9. and be denied that school lunch and instead be handed a brown paper bag with what I've heard oftentimes is like a cold cheese sandwich. So you can imagine what that does to that child in the moment, and then also over time, right? I don't think in this day and age, any student should be denied a hot meal in the lunch line. And that doesn't have to be our reality here in Ohio. And just as recent as 2019, there was a story that made national news where a student on his 9th birthday was attempting to access the hot meal and was denied that meal. Although that school district itself had made a change to prevent that from happening again, we still have that practice in many of our districts. In fact, there are some districts that prevent a student from graduating if they have accumulated school meal debt. So that's something that the state can also do and look at anti-lunch shaming legislation. Next slide, please. And that's really where I'll end. I would say please reach out if there are any questions, if you would like to join the campaign. We have lots of resources on our website, and I just really appreciate you having us today. Thank you so much.
Thank you, Catherine. I'd like to thank all of our panelists. We'll move to our next phase, question and answers. And
thank you, Senator. I want to again thank our panelists, Andrea, Catherine, and Alexis, for their dynamic presentations and sharing information regarding childhood hunger here in Ohio. At this time, I'd like to open up the conversations to our members and legislators to provide any commentary, thoughts, or ask any outstanding questions they may have to our panelists. Later on, we will take questions from our attendees and supporters. Please feel free to share your thoughts in the chat. Do we have any questions from our members of the Children Caucus?
one question I have about the shaming, the lunch meal debt, how prominent is that here in the state of Ohio? You spoke particularly specifically about Ohio, so I'd just like to know how much of a problem or issue that is.
Yeah, I'll pass this to Andrea because I know she actually recently, they had a policy shift. It really is district dependent. I know that it is still very much the practice in many districts in Ohio to once they reach a certain threshold that varies again across district of school meal debt, that they're given an alternate lunch, which is typically a paper bag with some sort of sandwich, cheese sandwich, peanut butter sandwich. So that I would say is still very much practice in the state. Andrew, do you want to talk a little bit about what it was in your district and how it changed?
Sure, yes. So as Catherine said, we did have a recent policy update. So in the past, we had a policy that after $20 charged, we would provide a peanut butter and jelly or a grilled cheese. Now it's tough to say unlimited because we don't want to rack up charges either, but we will provide students with the full hot meal if they do not have money or if they don't have a meal there without penalty. But that is because we did have a problem here with some shaming practices before I started, which were resolved and looked into, but that is the reason for our district's policy change, because it was a problem.
Yeah, and I did just want to jump in really quickly. I don't have specific numbers in Ohio, but I do know that before the pandemic, about 3 out of 4 school districts across the country were struggling with unpaid school meal fees. And so, unpaid school meal fees, they're kind of a symptom of how the programs operate because we're not offering free meals to all students. And so schools are faced with this really difficult choice when kids show up in the cafeteria without cash in hand or money in their school lunch account. And a lot of school districts will provide meals to kids, but then they have to go and get the money from the parents or else it comes out of the school district's general fund. And so, some of the challenges that we've seen around what happens in the cafeteria has a lot to do with that schools trying to manage that. And so, one thing school districts will say is if a child can charge up to a certain number of meals or cannot charge any meals. And then if the child gets in line, gets to the end of the line, this is a thing that we saw most commonly before the pandemic. They get to the end of the line, the school nutrition cafeteria staff realizes that the child doesn't have money in their account, and then they have to take the meal away and not reuse it, so it gets thrown out. And so that's the scenario that we saw in the news a lot. That's the scenario that Catherine was talking about that happened in Ohio that made national news. It's kind of a function of both how the school nutrition line runs, but then also the weakness of the school nutrition programs because schools aren't able to feed all the kids who are coming through the cafeteria. And then are left in this really, awful position. Do we provide a meal? Do we not provide a meal? Do we have to subsidize this lost school lunch fee with funding that should be paying for teachers and other educational costs? So that's kind of the challenges that school districts have, and it does not always play out as great as it should in the school cafeteria.
Thank you very much. I've got another question about the active campaign for Hunger Free Ohio. Is that limited mostly to schools providing lunch for everyone in schools, or is that expand beyond that?
Yeah, I would say our mission is to ensure that every student has access to a school meal. So both.
So it's limited. So it's limited to schools. The Hunger
Yes.
Free concept.
Yeah.
And do we have any idea what that will cost to provide those meals? Do you have budget information?
We have done some preliminary data analysis of our own, looking at pre-pandemic meal uptake, and then trying to gather sort of from the 2021-2022 school year. So we're somewhere in the range to cover both breakfast and lunch, and assuming a small percentage of increase, around 150 million per year. Again, which we don't think, compared to the 2 billion that we have to spend in ARPA money, again, we think that's a really important and worthwhile investment looking at this school year.
Thank you. Appreciate it.
Thank you, Senator, for your questions. Again, do we have any of our legislators that have any questions or comments for our panelists? All right, seeing none, I can refer to some of the questions we have in our chat. The first one we have is from Dustin Holfinger, who is the State Government Relations Director for the American Heart Association. We saw that the State Board of Education is discussing a request to ask the legislature to address the school meals waiver ending. Where's the legislature as a whole on this potential request? ARPA dollars could be used. So, Senator, the question is, where's the legislature as a whole on this stance from the request of the School Board of Education?
With ARPA dollars, the leaders, and since we have not been in session for some time now, the leaders are making decisions, and those are going through the controlling board. So I'm not really up to date on where the leaders might stand on the allocation of ARPA dollars to the controlling board at this time.
Thank you for Senator. Our second question is from Susan Tebben, who is a reporter for the Ohio Capital Journal. She would like to know why we focus on federal spending for free or reduced lunches rather than stabilizing the program on the state level. Also, could you take a little bit of time to speak about the historic efforts through the years to boost the program on the state level?
I need some help from the panelists on this one. That's the reason I asked a question about whether or not the active campaign was just being limited to schools, or was it expanding beyond that and trying to address child hunger?
Well, I can jump in a little bit and then others can add. So across the country, what we're seeing is a big focus on expanding healthy school meals for all, because kids can then rely on breakfast and lunch every school day. And what it does is it reduces the household food budget. So it really does kind of ease the pressure on the household, because the parents can rely on, 10 meals a week in order to reduce the amount of food that they have to purchase. And then there's some really interesting research that started coming out about the impact of offering free school meals for all on kind of food inflation, both the household food budget costs and then also costs in the grocery store when families are able to rely on more food, so they're not purchasing it in the grocery store. But the big focus that we've seen, is really states being very interested and very excited about the fact that they've been able to offer free meals to all students over the last 2.5 years, how amazing it's been for kids and families, how it's totally altered the environment in the school cafeteria, and how it's made it so much easier for school nutrition staff and directors so that they can focus their energies on providing meals instead and providing nutritious and appealing meals instead of pushing paperwork around. So I think that's where some of the energy comes from. So even though, the conversation isn't as much about, summer EBT or summer meal programs or after school meal programs, by leaning into offering free meals to all students, it's a really great way to support households and families as they struggle with kind of the increased food costs that they've been facing, and make ends meet better.
Yeah, and I'll just add to the part of the question that says, why are we focusing on federal spending for free or reduced lunches? I think, the school nutrition programs are federal programs. And so although states can step in and pass measures to go above and beyond what the federal government is providing, the federal spending, the reimbursements for meals are always going to be a key part of this school situation. And we'll work in tandem with what states do above and beyond that through legislation.
And I was going to mention the same thing that Alexis said, but I think just to add to that, so really what our ask is then that the state comes in and sort of supplements what isn't already paid for by the federal government, which the majority of is already paid for by the federal government. I think one thing to add here is that we will see over time the state share, if we were to do this, go down and the federal share go up, particularly next year. Ohio I have confirmation that we've applied for a Medicaid direct certification into free and reduced price meals, which means that students enrolled in Medicaid would then be directly certified for free or reduced price meals, which would increase our identified student percentage and increase sort of our overall federal reimbursement and ability to do more community eligibility provision, which is another thing that I think our state can invest in, helping to provide more technical assistance and more outreach around helping schools that would qualify for CEP but aren't currently participating in community eligibility provision, which is a way that they could provide school meals for all students in that district, many of which of our big sort of urban districts do currently.
Thank you so much. So it looks like we have a couple questions dealing with how ARPA funds are utilized to combat child hunger in other states, particularly those bordering Ohio. Do you want to speak to that?
The only example I can think of off the top of my head is Nevada. The Nevada governor designated ARPA funding to cover free school meals for all students for this current school year. So that's one example.
Thank you.
And then just to echo, I don't think it's necessarily ARPA, but Pennsylvania has just passed for free breakfast for all, and then the 4 other states, in addition to Nevada, have also passed legislation, not using direct ARPA funding, but have also done that.
Thank you. We have a question from Ethan Goodman. Does this research include summer meals, or is the work focused on breakfast and lunch programs? How can we ensure students who are food insecure have access to food during the summer?
Well, I can jump in a little bit. So the summer nutrition programs are designed to kick in during the summer when the school year ends. In Ohio and nationwide, the reach of the summer nutrition programs is only a fraction of the kids who participate in free and reduced price school meals during the school year. So we actually have a lot of work to do to get kids access to summer meals. And the great thing about the way the summer nutrition programs work is that they're often done in tandem with educational enrichment activities that actually provide support to counter summer learning slide and get kids outside and physically active and support social and emotional learning. And so those two are really important. And Ohio, just like every other state, could do a lot to expand access to summer meals because we know that summer can be a very hungry time for families. And the other strategy that has been piloted during the pandemic is to provide kind of an EBT card to replace the school meals during the summer. It was the pandemic EBT program. At the federal level, they've been piloting what they've called the summer EBT program for about a decade now. And both of those programs have been shown to reduce food insecurity and improve nutrition. So those are other things to think about and look at, as ways to make sure that kids get the nutrition that they need during the summer months. And states in the past have applied to be part of the summer EBT program. And so if that comes out like another RFA, we can definitely flag it for Catherine and make sure that Ohio is aware of it and, considers applying just like they did with the Medicaid direct certification program, which we think is going to be a game changer for Ohio as well.
Thank you. Let's see. Is there any risk in using ARPA funds to do this as our one-time dollars?
I think we'd love to see this be made permanent, right? And we want to see this sustainably done through our budget, which we think this year, particularly this budget cycle, this biennium, we would have the GRF, that we would have the ability to do so. However, I think as we're coming out of, although still very much amidst a pandemic, we have rising costs. We think this school year is particularly important, especially coming off of last school year when school meals were free for all students, that we think that the one-time need is significant enough and is there and would be a valuable start to getting to a place of sustainability through other funding for school meals for all. In addition, as I mentioned, I think that the state share would go down and that we'd see more federal money coming into the state through that Medicaid direct certification program, potentially through a child nutrition reauthorization at the federal level. So yes, we'd like to see this sustained, but we think the one-time need for this school year is very much present.
In conjunction with that, I've got a question about the survey of the parents in Ohio. Was the question phrased whether or not they wanted wanted the meals? Of course they do, but would they be willing to pay for them? I mean, would they be willing to increase taxes in order to pay for those meals? Was that part of the question?
That was not part of the question. It was did they agree or disagree with the statement of school meals should be accessible to all students at no cost, regardless of their ability to pay. And that's where it went. Though I'm not sure, maybe Krista or Alexis know if other states have done surveys that have looked at that part of the question. I don't think so.
Yeah, BRAC did some polling to find out what the public support number was for providing free healthy school meals for all. And I know that Minnesota did, and then I know Ohio did. And what's unique about Ohio is it was specifically for parents of K through 12 students. Yeah, I don't think that specific question has been asked, but a lot of really good data has been gleaned from these polls about what messages resonate with parents and stakeholders, and definitely the polls have showed support for this idea.
Yeah, and I think Colorado, when they did their polling, may have asked some questions about taxes. So we can actually go back and take a look at it. And if it's possible for us to follow up with information, we can share it after the conversation today.
Thank you. Appreciate it.
Absolutely. And we have one last question. What is the average cost for a school breakfast and lunch per child in Ohio?
I can tell you our cost. So our breakfast this year is $1.85, which is higher than it was in 2019. I think it was $1.65. For lunch at the elementary school, portions are a little bit smaller, so it's $3. The middle school, it's $3.10, and at the high school, it's $3.25. And schools around Lorain County, I talked to a lot of directors, we all collaborated in setting prices. So schools around the area are very similar to that.
Thank you. Since we have about 5 minutes left, is there any outstanding questions we have from our audience or attendees and or legislators? Senator, I'll pass it on to you for closing remarks.
Well, I want to thank everyone for their participation, particularly the panelists. It's a very informative information that's going to help us and help hopefully direct policymakers here in the state of Ohio to encourage us to strategize and how we can address this whole issue with child hunger. And as I indicated in my opening remarks, you know, we can and we must really end child hunger to ensure that our children are healthy and that they have the best chance in life. They're our future, and we need to make sure we invest in our future. All of this, the pandemic, the spending, ARPA dollars and so forth that we've used, the waivers and so forth, has given us information to help us and direct us to make better decisions as it relates to the feeding and the caretaking of our children. So we will move forward, I believe, in a positive manner to help stabilize more funding, state dollars to this effort. Today's program is a call for action for how leaders to implement policies that address food insecurity and support efforts to reduce child hunger. We appreciate everyone's attendance. Thank you very much.